All right, good afternoon, everybody. If everybody can kind of come in just a little bit. First of all, I just want to say thank you to everybody for making some time out of your day and coming to C4K to support this initiative. We're so happy to have you. So I just want to invite to the podium our CEO of Cure for the Kids Foundation, Christine Ton.
Thank you. I have just a short welcome for you all. I'm so excited to be here today. It's so fun to talk with so many of you and celebrate what we're here to celebrate today. So I want to welcome you here and celebrate our newest partnership with United Healthcare. Since the opening of Cure for the Kids Foundation, we have had the privilege of caring for the members of each of the health plans offered by United Healthcare in our community. We have enjoyed a partnership based on the shared goal of expanding access to subspecialty care for pediatric patients. Cure for the Kids Foundation is proud to share that over the last decade alone, it has provided over 10,000 United Healthcare Plan members with more than 70,000 visits in various subspecialties offered at Cure for the Kids Foundation, including hematology, oncology, rheumatology, genetics, orthopedics, and more. On many occasions, we have come together in a boardroom or over the phone to discuss the unique challenges faced by our shared patients and their families. We have worked together to overcome administrative barriers, to shorten hospital stays, and expand access to new medications and research protocols. Last month, our partnership resulted in our great state's very first gene therapy infusion. But today, Cure for the Kids Foundation and United Healthcare have come together to further address the acute shortage of pediatric providers in our community, a shortage that directly affects the health and welfare of many of Nevada's youngest residents. To support the workload of our subspecialists by way of alleviating administrative challenges, shortening wait times, preventing physician burnout, and enhancing patient experience, Cure for the Kids Foundation aims to grow its provider team through the addition of qualified nurse practitioners. United Healthcare, through its Health Plan of Nevada Medicaid program, has committed to support this effort by providing Cure for the Kids with a $100,000 grant to grow its nurse practitioner team. Cure for the Kids Foundation is honored to receive these funds, and to United Healthcare we say thank you. And we thank all of you here today celebrating this new partnership with us. Without further ado, I am privileged to introduce the Director of Bleeding and Clotting Clinics at Cure for the Kids Foundation, Dr. Amy Ford. Dr. Ford moved her family to Las Vegas in January of 2022 to join Cure for the Kids Foundation. She has a passion for treating benign hematologic conditions, and I ask you to please help me welcome Dr. Ford.
Hi, everyone, and I just want to say thank you to United Healthcare for this wonderful gift. I am so excited and honored to welcome Jeanette to our team, and more specifically to our sickle cell team. When I met Jeanette a few short months ago, it was clear that she had a passion in helping the sickle cell community of Las Vegas. Jeanette's work experience as a general pediatric provider and a home health worker makes her a great fit to advocate and care for this community. As soon as she started at C4K, she quickly jumped in to learn about the complications and special surveillance exams that these patients need throughout their pediatric life. I also made her jump in because I went on maternity leave. Um, so in addition, she has a plethora of projects, and her mind is always running, and she's so excited about all the new and exciting things she can do for these patients. To help the program and our over 250 patients with sickle cell that we take care of every 3 months, every year they come to comprehensive clinic. She will really help these patients grow and flourish. We are excited about her dedication and can't wait to see what she can do with our team. Thank you so much.
All right, so I'm Tricia Sellers. I'm one of the medical directors for United Healthcare, HPN. And I see some familiar faces out there. It's always nice to come and visit Cure for Kids. If you don't know, I have been a pediatrician here in Las Vegas since 2006. Most of that time as a hospitalist at Summerlin. And so I kind of have had a unique view watching C4K evolve over time. So seeing it go from a couple doctors to now a multi-specialty group. It's been awesome. I used to work with Dr. Stewart, who's so great in orthopedics on the inpatient side, so it's awesome that he's here now for some complex cases. And my kid's first dentist is here now, providing all the excellent care to the kids and their families here. I also got to see the inpatient service be anchored at Summerlin, and it's been a privilege to work closely with all the doctors, so Dr. Aikida, Lasky, Alhushki, Dr. Gupta, and I think Dr. Ford and I, we had kind of a short overlap at Summerlin as I was leaving and she was coming. I've seen, it takes a special person to be a pediatric oncologist, and a little added bravery and resilience to do it in Las Vegas, where it's a burgeoning medical community. So I'm grateful, for these fine physicians. They're committed to providing the excellent care even in the most difficult of circumstances. Kind of a lot of growth has occurred, and we all know there's a shortage here in physicians, so it's great that we can be here and celebrate more growth. So I want to introduce Dr. Lambert Wu. He's our CMO for United Healthcare Health Plan of Nevada Medicaid. He is a cardiologist for adults, but we won't hold that against him. We've worked together for a couple years, and he's amazing, good at seeing the big picture, and has been here for a long time and well-versed in the challenges of Las Vegas. And so I'm happy to turn it over to him, and he can share more of our good news.
Well, thank you, Tricia. I first of all have to say it's just a blessing for us at the health plan to have an amazing medical director like Trish, Dr. Sellers. She gives us a lot of insight into the needs of the pediatric community and patients, providers, practitioners. So really a blessing to have you, Tricia, and I turn to her a lot when I'm having some questions about pediatrics, believe me. Yeah, but adult cardiologists, when we see pediatric congenital cardiology, it gets to be that's for those special people. Well, I have some prepared comments, and I'll just, if you might indulge me for just about 2 minutes here as I speak. Ladies and gentlemen, distinguished guests, and valued colleagues, as we know, September is National Sickle Cell Awareness Month, and in designating this month as such, our Congress hoped that it would focus national attention on the continued need for research and treatment of sickle cell disease. That being said, it is a true honor for me to be here today, for United Healthcare staff, all of us here to be present with you. But a true honor for me to be here today representing United Healthcare Health Plan of Nevada Medicaid as we acknowledge and support the incredible work being done by Cure for the Kids Foundation in the fight against sickle cell disease. As a chief medical officer, I have had the privilege of witnessing the profound impact that innovative and compassionate care can have on the lives of our most vulnerable patients, especially our children. As you know, sickle cell is a condition that requires not only medical expertise, but also a deep understanding of the unique challenges faced by those affected. The children living with this condition often endure pain, as you all know, hospitalizations, and disruptions to their daily lives that most of us can scarcely imagine. It is our responsibility as healthcare providers to ensure that these children receive the highest quality of care and support. Today, we as United Healthcare Health Plan of Nevada Medicaid are not just presenting a primary care investment check for $100,000. We are investing in hope with you. This contribution to our sickle cell program is a testament to our shared commitment to making a tangible difference in the lives of these young patients and their families. You have already demonstrated excellence in delivering high-quality care in multiple condition areas, from early diagnosis and prevention strategies to acute management and long-term support. This funding will enable you to expand these efforts, reaching more children and providing them with the care they so desperately need. We know that tackling sickle cell disease is not easy. It requires a multidisciplinary approach. This involves the dedication of physicians, advanced practice nurses and associates, laboratory technologists, social workers, and administrators, and many others. But it is through this collaborative effort that we can bring about meaningful change. Together, we can ensure that these children thrive, living fuller, healthier lives, despite the challenges they face. So, on behalf of United Healthcare Health Plan of Nevada Medicaid, I want to express our deepest gratitude to Cure for the Kids Foundation for your unwavering commitment to these children and their families. We are proud to partner with you in this endeavor and look forward to seeing the positive outcomes that will result from this investment. Thank you very much.
Thank you. Well, thank you for everyone for joining us today. We cannot overestimate our gratitude for the unwavering support of the Cure for the Kids mission from United Healthcare and Health Plan of Nevada Medicaid and all of the people that are here today. So thank you, thank you. And as September does mark the National Sickle Cell Awareness Month, it is especially meaningful to be here with all of you today, celebrating this incredible partnership. It allows us to expand our comprehensive sickle cell program, like everybody's talked about. And for those of you who know me, know that I'm passionate about a lot of topics, and I never stop talking about them when I'm passionate about them. So here we are again today, and I'm passionate about talking about the need for comprehensive care within our sickle cell program. And this partnership is a game changer for us. And I'm so eager to see all of the positive impacts that this will have on our patients and their families. And one thing that I'm particularly excited about is how this expanded team will help support the state of Nevada in collecting sickle cell specific data. We all know that data is the bedrock of any effective public health response. And with more accurate information about the prevalence, the demographics, and the needs of those living with sickle cell disease, we can better allocate resources, advocate for important critical policy changes, and most importantly, ensure that no patient is overlooked or underserved, which is often something that we have seen not only locally but nationally with the sickle cell patient population. So together, with the power of data and the strength of our community, we can transform the future for sickle cell patients across Nevada. And thank you for helping us do exactly that. Please stay and enjoy some snacks. If there's anybody who's interested in a tour of our facility, You can meet a C4K team member right over here by the elevators, and we'd be happy to provide you with a tour. And just thank you again for coming, and we're grateful to everybody at United Healthcare, Health Plan of Nevada Medicaid, for your trust in us and your belief in our ability to do a good job with sickle cell patients in Nevada. Thank you.